Hello, my name is Michelle Fleming and I am a nursing student at the University of Canberra. That's me. So for my OSCAR or Inc. 5, I'm going to take it away with a case study. So the first thing I want to do when I go into the room after he's had, like Beck did the assessment, the abdo, and she was going to do the vital signs, I'm concerned that the vital signs on the monitor don't match the vital signs that are documented on the OBS chart. So basically what I'm going to do is, if I was going off the monitor, I'd be escalating care. I'd be doing that because his rest rate is increasing, his temperature is on the rise, and his heart rate is also trending upwards. And his baseline systolic blood pressure is around 140 and he's sitting at 98 on the monitor. So that's my rationale for that, knowing that the cardiovascular system and the way that works, he hasn't had, I don't think he's had his blood pressure medications, I don't know, but it is quite low for him. So I would be investigating that further. I also know that he was admitted to hospital on the 3rd of March, and it's now the 5th. I'm not sure if I'm taking over from morning shift or what I'm taking over from, but the last progress note was documented at 21:50, and that was on the 4th. So I don't know what. There's nothing documented about the pain relief that he's had overnight. So I'm a bit concerned about that. I also know that he's reaching his maximum dose of oxycodone. So he can only have 50 milligrams in a 24-hour period, and he's reaching that dose. So what I'm going to do is I'm going to escalate my concerns to the team leader using the ISBAR framework, and I'm going to do that because I believe that he needs something more consistent or something different to help alleviate his pain, because he's saying that it's 8 out of 10, which is quite high. And I know that he's got that extensive bruising to his right side, and I know that he's also got the contusions on his forehead, and this is indicating that, and with the abdo pain, that he likely might have sustained maybe some fractures due to the musculoskeletal system and the way that it's he's hit the tree at 50 kilometres an hour, which is quite extensive, and we know about the velocity and the force that has impacted that even though he didn't lose consciousness, I think that he needs a neurological assessment, because there can be a delay, and he hit it quite hard. So my understanding of the force that he's hit it with, that it could cause further injuries that are masked in the beginning, especially in the abdominal area, because of cavitation and that penetrating, like hitting the tree at that force, and the back and forwards motion, moving his head, and even that's real. He's obviously been ruled out of having any spinal injuries, but yeah, they can mask later on, especially in the abdominal area, because they're yeah. So that's my rationale for that. I'm also thinking that he needs to have so like a chest X-ray to rule out fractures. He might have flail segments or some fractures there, and that could be indicating of a pneumothorax, especially due to his oxygen saturations on the monitor was 90%, so that's quite low, and it looks like he's on oxygen 2 litres from what I can gather from the video. He's got oxygen on, and the OBS chart says he's on 2 litres. So I'm thinking that he needs more investigations around his respiratory system, because he's short of breath, and he's coming in, he's saying that he feels awful, he's got sore guts, he's got awful chest pain. So just to rule that out. Also know that he's feeling nauseous, and he does have ondansetron there, and he's only had 2 doses of that, and he can have it every 6 hours, so I would be advocating for that. And I think that would be good for him, especially prior to having the scans done. Yeah, so I do believe that he needs to have a chest X-ray, an abdo CT, and a brain CT even to rule out any hemorrhaging or bleeding in the brain or in the abdomen, and to see what's going on in his with his lungs and his respiratory system. What else? I also know that he has a history of PTSD, so I'm mindful of this when I'm doing my assessments and when I'm communicating with him. So I'm going to be talking to him and communicating about what is happening, especially around pain relief and medication and the scans that he's having. I'll be making sure that he's the focus of the care, because it is his body and it is his experience. And just discussing with him if he has any concerns, and if there's something that hasn't happened that he's not disclosing. So I know that he didn't go into hospital straight away, and the farming world can be quite stoic. So just being mindful that to reinforce that he's in a safe place and that he can talk about concerns that he's having. I'm also going to use so I'm doing a primary survey as soon as I go in there. I'm looking at his airway, if he's able to talk, if it's obstructed, and it seems to me that he can. And I'm looking at his circulation, paying close mind to his heart rate, and it is quite high. Like on the monitor it said it was 99, so I'm mindful of that. It's getting to the tachycardic stage where, if that happens, we need to be wary of complications, with the rhythm of his heart. He looks like he's in normal sinus rhythm on the ECG. But yeah, just monitoring that and communicating my findings to the team constantly. And the circulation, like I said before about his blood pressure, and his peripheral circulation, like how does he look? I know he's got the bruising, but is there impaired, like what does his skin look like? And I'm looking at the disability. So I do like an APU just to see if he's alert, if he's orientated, if he's if he can communicate well, things like that. And that I'm doing that to get a baseline to see if he neurologically is sound at that stage, and to get a baseline to see if he changes throughout the shift. And I also want to see, exposure, like what his temperature is, if it's it is quite high at the moment. So, and I might even advocate for some blood tests, just to see what is going on. Like if he's got, he might have, the temperature could be due to lots of different things, and it could be due to the fact that he is in quite a lot of pain and he has trauma, and he also might have an underlying infection that we don't know about, so I'd be advocating for that. And I'd be doing that because I believe that he needs to, we need to see what his, because he has had abdominal injuries, what his kidney functions are like, what his liver functions are like. So an LFT, I want to see what his EGFR, so just doing those sorts of things and getting the white cell count as well, to see what the inflammatory markers are like too, so an EUC, and we're doing things to make sure that his kidney and liver functioning is working well. I know he's almost 50, so he's he's not an elderly man, but he has sustained quite a significant trauma. So I'm also going to be assessing and documenting all of my findings. Like I said before, I want to do a baseline of observations and investigations, and I might even do an ECG just to rule out, to see what's happening with his heart, because he does have a history of hypertension, and because his blood pressure is quite low and his heart rate is quite high. I know the seagull signal, and your heart rate shouldn't be higher than your systolic blood pressure. So I'm looking at that, and I'm also going to be using, like, after I do the primary survey, I'm thinking of the secondary survey, so like the head to toe assessment, using the AMPL framework. I think this is a really good framework to use to just gather some information that might be vital in caring for him, especially in regards to if he has any allergies, if he's on any medications that might be contributing to some of the symptoms that he's on now. Like, he's had quite a lot of pain relief. Maybe he takes pain relief at home, and it's not holding him because he needs more, basically. What his past medical history is, why does he have PTSD, things like that. The last time he ate, in case he does have to go to theatre, I think this is really important because he might have more extensive fractures that will be investigated, especially if they do a scan and they find that he has any fractures that need surgery, basically. So they're not always evident on the first presentation without the scan, so and the x-rays. So I think that's really important. And the events leading up to what happened, we want to know if was he drinking before he got on the quad bike? Does he have a family history of seizures or things like that, just to rule out, just to gain a better medical history of what's happening, so that we can plan the care accordingly around that. And sometimes people don't disclose things straight away, so I think it's really important using that AMPL framework to gather as much information as we can to plan care. I'm also going to be offering education to him about what's happening, especially in regards to the scans and what's going to be happening. We know that the method of injury was an impact trauma, so he's hit the tree quite hard. So he may have a bit of confusion about what the plan of care is. He may not have been to hospital before. So just little things like explaining when you're doing an abdominal assessment, which I would do again, and a respiratory assessment. So listening and feeling, palpating, auscultating. So just really getting a good baseline of what's going on to see if we can hear any crackles, and to educate him on what we're doing, and because it can be quite frightening for patients if things are not, they're not working as well as they should be, and they're not sure what's going on. Yes, so I'm also going to advocate for a blood gas as well, so an ABG, and I think this is because the amount of oxygen and carbon dioxide in the blood, it's important to know what that is. If the lungs are able to move the oxygen into the blood, and if that's impaired, because he is short of breath, that's what he's saying, then we need to be mindful that oxygenation, that ventilation, that exchange is not happening as well as it should be. So I'm going to do that as well. Yes, I might even do like a CAM to just to rule out any more confusion, like an adult confusion assessment test. And what else will I do for him? And I'm just thinking of positioning too in the bed, like just sitting in more of a semi-phallus position. He might, an ice pack might help, relieve some swelling and the bruising. Just little things like that while I get the pain relief under control. I want to try and get him his pain relief as quickly as possible, and his nausea medication, and try and get some of those tests done so that he can get some answers and we can plan the care accordingly. So thank you.